Antifungal agents. Most of the fungal infections are opportunistic, hence they are common in diabetes mellitus, cancer, AIDS, pregnancy, in patients on broad-spectrum antimicrobial agents, and on immunosuppressant therapy such as prolonged course of corticosteroids, anti-cancer drugs. Classification of antifungal agents. Pollen antibiotics are amphotericin B, nystatin, hemicin. Echinocandin antibiotics are caspofungin acetate, mica. Heterocyclic compounds is griseofulvin. Azoles include imidazole, triazole. Imidazoles are ketoconazole, miconazole, clotrimazole. Triazole are fluconazole, itraconazole, voriconazole. Alelamine is terbinafine, antimetabolite flucytosine. Other topical antifungal agents are whitefield ointment, tolnafate, sodium thiosulfate, selenium sulfide, and pollen antibiotics. Amphotericin B, nystatin, and hemicin are pollen antibiotics. They have the same mechanism of action. Amphotericin B is a broad-spectrum antifungal antibiotic. It is effective against Cryptococcus, coccidioids, Candida, Aspergillus, Blastomyces, Histoplasma, Sporothrix, fungi causing mucormycosis. Pharmacokinetics of pollen antibiotics. Amphotericin B is not absorbed from the gut, hence is not suitable orally for systemic infections. It is highly bound to plasma protein and sterols in tissues, widely distributed in various tissues but does not cross blood-brain barrier. It is metabolized in liver and excreted slowly in urine and bile. Mechanism of action. Fungal cell membrane contains a sterol which resembles cholesterol and is called sterol. Amphotericin B, nystatin, hemicin bind tightly to ergosterol in fungal cell membrane, form pores and channels in the membrane. Permeability of the membrane increases, leakage of intracellular contents cause the death of fungi. Adverse effects. Amphotericin B is the most toxic of all antifungal agents. The toxic reactions are fever, chills, headache, dyspnea, gastrointestinal disturbance, phlebitis at the site of injection, etc. Anemia and electrolyte disturbance are commonly seen. Anemia is less with lipid formulation. Nephrotoxicity with azotemia is seen in most of the patients on amphotericin B therapy. Hepatotoxicity can occur occasionally. Headache and convulsion may occur on intrathecal administration. Uses. Amphotericin B is highly efficacious but highly toxic too. Hence, azoles have replaced amphotericin B in the treatment of many fungal diseases. Intravenous amphotericin B is the drug of choice for mucormycosis. It is also useful for aspergillosis, cryptococcosis, sporotrichosis, histoplasmosis, and blastomycosis. Nystatin. Nystatin is poorly absorbed from skin and mucous membrane. It is highly toxic for systemic use. It is used only topically in Candida infections. It is available as suspension, ointment, cream, powder, tablet, and also in combination with corticosteroids or antibacterial agents. Uses. Nystatin is used topically for oral, oropharyngeal, corneal, conjunctival, and cutaneous candidiasis, as oral tablets for intestinal candidiasis and superinfection due to candida, in vaginal candidiasis as vaginal suppositories. Adverse effects. They include nausea and bitter taste. Hemicin. It was developed in India. It is useful topically for oral, cutaneous, and vaginal candidiasis. Echinocandins. Caspofungin acetate. Caspofungin acetate is a semi-synthetic antifungal agent effective against Candida and Aspergillus. It is an antifungal antibiotic that acts by inhibiting the synthesis of glucans in fungal cell wall. It is not effective orally and is administered by IV infusion, metabolized in liver, and metabolites are excreted in feces and urine. It is used in the treatment of invasive aspergillosis and candidiasis when patient is not responding to or intolerant to other antifungal agents. The adverse effects include nausea, vomiting, flushing, fever, and phlebitis at the site of infection. It is expensive. Micafungin. The mechanism of action is similar to caspofungin. It is administered for treatment of invasive candidiasis. It is also useful for prophylaxis of invasive candidiasis and in patients undergoing stem cell transplantation. Griseofulvin. Griseofulvin, an antifungal antibiotic, is used orally for dermatophytic infections. It is not effective topically. Mechanism of action. Griseofulvin interact with polymerized microtubules, disrupt the mitotic spindle. Spindle poison, thus griseofulvin inhibits fungal mitosis. Pharmacokinetics. Griseofulvin is administered orally. Its bioavailability is increased by taking with fatty food and by using ultrafine preparation. It gets concentrated in keratinized tissues such as skin, hair, nails, etc. It is an enzyme inducer, thus reduces the effectiveness of warfarin and oral contraceptives. It has disulfiram-like action, hence can cause intolerance to alcohol. It is metabolized in liver and excreted in urine. Uses. Griseofulvin is used in the treatment of dermatophytic infections. The duration of treatment depends on the site of lesion and thickness of infected keratin layer. Treatment must be continued until infected tissue is completely replaced by normal skin, hair, and nail. For tinea infection, 4 to 6 weeks of therapy is required. Ultrafine griseofulvin 250 mg 4 times a day for 4 to 6 weeks is given. In onychomycosis of fingernails, griseofulvin 250 mg 4 times a day for 6 months, and for toenails treatment up to 1 year is required. Triazole or terbinafine is preferred for onychomycosis. Adverse effects. They are headache, rashes, peripheral neuritis, confusion, fatigue, vertigo, blurred vision, and GI effects such as nausea, vomiting, diarrhea, heartburn, etc. The other side effects include leukopenia and rarely hepatotoxicity.